Welcome back, everybody. By now, many of you know today's my first day back after a 3-month medical leave, after a diagnosis called Chiari Malformation 1. It's a brain disorder that is more common than many people think, but it's a brain disorder many people don't know much about. So I've invited one of the many neurosurgeons I have personally visited with to sit down with us today to talk about what Chiari is. So please help me welcome Dr. Marcela Madera to Weekend Day. Rick, welcome. Thank you very much for agreeing to do this with us. So first of all, tell us what Chiari Malformation 1 is.
So Chiari Malformation is a disorder in which the bony structure at the back of the brain is too small, and that causes the cerebellar tonsils, which is the bottom part of the back part of the brain, to protrude into the spinal canal. That causes an alteration of this flow of cerebral spinal fluid and causes pressure on the spinal cord and brainstem, leading to many different symptoms.
Sure, and there's 1, 2, and 3. I have 1, so quickly tell us the difference between all of them.
So Chiari 1 is by far the much more common version of Chiari. 2, 3, and 4 are associated with congenital defects or other types of birth defects. So the Chiari 1 is much more common in adults. It's the only one that's seen in adults.
Okay. And so, what are the symptoms?
So because the brainstem is responsible for so many neurologic functions in the body, there is a wide variety of symptoms that can be seemingly very unrelated or unusual. The most common symptoms are pressure-like headache at the base of the skull, especially with bearing down, coughing or sneezing, balance problems, trouble swallowing, and sleep apnea. Those are some of the most common, but also you can have blurry vision, you can have ringing in the ears. The range of symptoms is very large.
And so at what point should someone become concerned?
Well, certainly if someone has an MRI that shows a diagnosis of Chiari malformation, it's important to be evaluated by a neurosurgeon who has experience with this, because not every imaging finding surgery is necessary. So certainly if you have an imaging finding, that's a reason to see someone. And then if an adult has headaches that have been worked up and still a source is not found, an MRI is important to evaluate for this diagnosis.
And let's be clear, an MRI or CAT scan is the only way to find Chiari.
So in terms of the imaging findings, yes, MRI or CAT scan is the only way to see it. MRI is much more detailed, and you'll actually see the brain structures on MRI. But the diagnosis in terms of clinically needing treatment is very much based on a physical exam, neurologic exam with a neurosurgeon.
And so, you saw me and you saw all my MRIs, and so and you made your recommendations as well, and the symptoms can be very serious, and not everyone needs surgery. A lot of people have Chiari and you go on and live a perfectly normal life, and symptoms, you have it and are asymptomatic, right? And why is it that symptoms present itself in the 20s and 40s?
We don't really have a good understanding of that. What we think is that it's a very, very long time of that fluid pressure problem going on in the back of the brain and with the brainstem and the spinal cord, and at some point the brain decides that it can't handle it anymore. But there's a cluster, smaller group of patients that do present in childhood, so there is a childhood form of Chiari 1, but the adult form, usually 20s to 30s, but even up into the 40s and 50s is possible.
So physically what's going on? So here's your brain, and it's supposed to sit above your spinal canal, right?
Correct.
But with me, like the tonsil is dipping into the spinal canal.
Correct. So there are 2 tonsils, and they dip into the spinal canal. And if you can imagine, with your heart beating, that causes a pulsation of the spinal fluid in your brain, cerebrospinal fluid. So with that pulsation, you get this constant beating of those tonsils where they're not supposed to be, and that pressure wave is what causes the dysfunction in the brainstem and spinal cord.
And so, so it's not supposed to be down there. And so, worst case scenario, it's not lethal, but if left untreated, what can happen?
So the most severe symptoms are symptoms of brainstem dysfunction. So trouble swallowing, sleep apnea, respiratory problems at night or breathing problems at night, weakness or numbness in the arms or legs. There's another condition called syringomyelia that can happen, which is a cyst in the spinal cord, and that can cause the severe arms and legs symptoms. So difficulty walking, difficulty using your arms and legs. Most people who who have that severe of symptoms are diagnosed, somewhere during their course of having those severe symptoms and get treated.
Sure. And Chiari, what is it? Malformation 2 or 3, spinal bifida, right?
Yes. Yeah.
Right. And so we're talking severe. And surgery, I think you and I discussed, slows the progression of symptoms and is not a cure. Is that?
True. I mean, I would say, so the literature says that 80% of people who get surgical treatment for Chiari do experience quite a bit of improvement. So it's a cure in that in many patients you can get back to completely normal, but it's definitely a spectrum. So not everybody gets 100% relief, but many people get 80% plus relief. So most of my patients will get back to normal life, back to work, back to caring for their children.
But the important thing is people need to go seek help. I mean, if you're listening and you have some of these symptoms, you cannot, don't go see your general practitioner. You need to go see a neurosurgeon.
For sure, see a neurosurgeon if you've been told that you have an imaging finding that is consistent with Chiari, and certainly if you have a headache situation that has not been completely worked up, this is a possible diagnosis.
Not a normal headache, not a migraine. It is one of those that you stop breathing. It is so painful. Thank you so much, Dr. Madeiro. We've run out of time, and we will be right back.